When I was 16 years old, I read a Reader's Digest article that described a surgery to take out a meningioma. And it actually described step by step exactly how the surgery was done. And I found that really fascinating. And so I knew when I was 16 years old that I was going to be a brain surgeon. I've narrowed myself down to concentrating on some areas that are extremely unusual for neurosurgeons to deal with. And those are problems that are primarily handled and taken care of by neurologists. In fact, the best way to take care of these conditions is to work as a team. One of the main things that I deal with are patients that have epilepsy, which is a very common condition. Unfortunately, about 30 or 40% of people that have epilepsy cannot have their seizures completely controlled by medication. The first thing I tell patients, we're here to talk. I'm not going to do any surgery today. You're not going to leave here with a new scar. We're just going to talk about your problem and decide if surgery is the right thing for you. A lot of patients can be treated with radiation, which doesn't require making a cut in the skin, but it's a way to treat a problem that might often be treated with a real surgery with a knife, but can often be treated very effectively by using a radiation or focused radiation approach. The most rewarding thing about doing neurosurgery is that I have a big impact on people's lives. When I take care of patients that have the kind of problems that I typically deal with, that are very specialized problems, that I can offer somebody a future that is better than that they would have if I wasn't around. For many patients, their surgery is like a new birthday. Most patients remember the date they had surgery, brain surgery, and every year they'll often write me a letter and tell me that they thank me for having changed their lives or making such a difference in their lives.